The goal of this video lecture is to review characteristics of our first group of mood disorders, depressive disorders. We'll discuss characteristics of depressive disorders and the diagnostic criteria for the disorders included in this category of the DSM. When we're talking about mood, we're talking about sets of subjective, emotional, or affective experiences, behavioral patterns, and patterns in cognition that tend to co-occur. Mood disorders are disorders that are characterized by deviations from a typical mood state, what we call euthymia. We can divide our mood disorders into two primary categories. Depressive disorders are characterized by mood states that are low relative to a euthymic mood state, what we call depressed mood. Another major category of mood disorders, bipolar disorders, are characterized by mood states that are elevated compared to a euthymic mood state. These elevated mood states include hypomania and mania. You'll learn more about these mood states and bipolar disorders in another video lecture. We are going to focus on three primary disorders that are classified as depressive disorders in the DSM-5. These include major depressive disorder, persistent depressive disorder, and premenstrual dysphoric disorder. We'll begin with our prototypical depressive disorder, major depressive disorder. In another video lecture, you'll learn more about the DSM criteria for a major depressive episode. To receive a diagnosis of major depressive disorder, an individual needs to have experienced at least one major depressive episode. A major depressive episode is characterized by the presence of at least 5 symptoms. These symptoms include mood symptoms, such as depressed mood and loss of interest. At least one of these 2 mood symptoms must be present. They can also include somatic symptoms, such as changes to appetite or weight, and sleep dysregulation. There are also cognitive symptoms, such as problems with concentration or attention, or thoughts of suicide or death. To meet criteria for a major depressive episode, an individual needs to demonstrate 5 of these 9 symptoms for a duration of at least 2 weeks. The symptoms need to be present for most of the day, nearly every day during that 2-week period. The symptoms need to cause distress or impairment to the person experiencing those symptoms, and these symptoms can't be attributable to the effects of a substance or to another medical condition. We can consider our other depressive disorders in relation to major depressive disorder. The next disorder we'll talk about is persistent depressive disorder. In the DSM-4, this disorder was called dysthymic disorder or dysthymia, so you may also see this term. The primary differences between persistent depressive disorder and major depressive disorder are the severity of the symptoms and the duration of the symptoms. Persistent depressive disorder is characterized by persistent low-grade depressive symptoms. The individual needs to have experienced depressed mood for most of the day, most days than not, for at least 2 years. This is characterized by similar symptoms to what we saw for major depressive disorder, including changes in appetite and sleep, low energy or fatigue, low self-esteem, difficulty concentrating or making decisions, and feelings of hopelessness. In order to meet criteria for a diagnosis of persistent depressive disorder, an individual needs to have been experiencing symptoms for a 2-year period of time, and during that 2-year period of time, they can't have experienced a period of more than 2 months where they were not experiencing depressive symptoms. In comparison to major depressive disorder, the symptoms of persistent depressive disorder must be present over a longer period of time. However, the severity of the depressive symptoms required for diagnosis is not as severe as required for a diagnosis of major depression. For example, an individual with persistent depressive disorder might experience poor appetite, low energy, poor concentration, or feelings of hopelessness, but they may not meet full criteria for a major depressive episode. So persistent depressive disorder can be less severe than major depressive disorder, but it is longer lasting. It is also possible for an individual to meet diagnostic criteria for both disorders. For example, an individual who has symptoms that meet criteria for a major depressive episode for at least 2 years would receive a diagnosis of both major depressive disorder and persistent depressive disorder. An individual can also experience an episode of major depression on top of chronic low-grade symptoms of persistent depressive disorder. You'll sometimes see this referred to as double depression. The final depressive disorder that we'll discuss, premenstrual dysphoric disorder, also differs from major depressive disorder in terms of its time course. Premenstrual dysphoric disorder is an interesting mood disorder because the onset of mood symptoms is related to a specific event, in this case, the onset of menses. Premenstrual dysphoric disorder is a disorder that people experience where the onset of mood symptoms and related symptoms is clearly linked to an individual's menstrual cycle. Premenstrual dysphoric disorder can be diagnosed when an individual experiences symptoms during the week leading up to the onset of menses. Symptoms begin to resolve during menstruation, and when symptoms are absent in the week following menstruation. These symptoms can include depressive symptoms, but the mood symptoms of premenstrual dysphoric disorder can also include mood symptoms like irritability, anxiety, and mood lability, which refers to a very reactive or very intense mood. In addition to experiencing at least one mood symptom, the individual needs to experience a total of at least 5 symptoms. These can include additional mood symptoms or other symptoms like loss of interest, difficulty concentrating, low energy or fatigue, changes in weight, appetite, or sleep, a sense of being overwhelmed, or physical symptoms like bloating or breast tenderness. In order to meet diagnostic criteria for the disorder, this needs to be true for most of the menstrual cycle that an individual experiences over a 12-month period of time. So we can see that the kinds of mood symptoms associated with premenstrual dysphoric disorder are broader than the mood symptoms that characterize major depressive disorder. So premenstrual dysphoric disorder differs from major depressive disorder, both in terms of the nature of the mood symptoms, in that we can have other abnormal mood experiences in addition to the depressive symptoms, and also because the timing of symptoms, rather than seeing mood symptoms persisting over at least a 2-week period of time, we're seeing them linked to the menstrual cycle. To sum up, all of these disorders are characterized by mood states that are low relative to a euthymic or neutral mood state. The disorders differ from one another in terms of their specific mood and other symptoms that are present, the severity of the symptoms, how long the symptoms last, and the timing of those symptoms.